Our new global cornea report covers the entire cornea treatment landscape, from the disease populations to the manufacturers making the products that provide treatment. The report provides an overview of corneal diseases and estimates for disease populations. We also discuss organ donation policy, regulations, the role of corneal specialists, eye banks, and other organizations. The report discusses cornea products and treatments and provides a 5-year revenue forecast for corneal transplants, therapeutic lenses, birth tissue grafts, PTK procedures, interstromal corneal ring segments, and corneal cross-linking. The report includes estimates for 50 corneal diseases and the disease population, and we've categorized the diseases in 6 categories, including corneectasias such as keratoconus, corneal dystrophies such as Fuchs dystrophy, keratitis of all types, infectious diseases with ocular manifestation, congenital diseases, and acquired corneal diseases and corneal trauma such as burns and abrasions. A detailed estimate for the population with keratoconus is provided in the report, as well as different views of this population, and we include estimates for those with keratoconus and access to care. We also show a breakout of the younger population that has access to ophthalmic care, since that's typically the target treatment group for keratoconus. We consider over 70 products from over 50 companies in our forecast. We also discuss upcoming technologies and products such as artificial corneas and cell-based therapies that have yet to recognize market revenues. Eye banks, NGOs, charities, and research institutions are also considered, and we also provide 14 in-depth profiles of the key market players in the cornea landscape. The report provides in-depth coverage of the corneal transplant landscape. We provide a 5-year forecast for corneal transplants by region, by surgical technique, and by indication. For example, for each region, we provide an estimate for how many transplants are forecasted for Fuchs dystrophy versus keratoconus versus infectious keratitis or regrafts, and we show this breakout for each of our 8 regions. Corneal transplant surgeons and patients have had to deal with a unique set of challenges since the onset of COVID-19. The ophthalmic industry as a whole has had to deal with a decline in surgical volumes and adapting to new protocols, patient fears of coming into the office. And on top of these issues, the corneal space has had to deal with eye banks adjusting to new protocols for recovery of tissue. Some states are reporting an increase of out-of-hospital deaths for non-COVID related deaths such as stroke and heart attack. And when a death happens outside the hospital that would have otherwise been in the hospital, the organ donation process is much less likely to be triggered, so you have a downstream effect of a decrease in potential donor tissues. There's also logistical challenges with all the travel restrictions varying from country to country, state to state even, and whenever you're dealing with organ donation, those things matter. A lot of airlines have changed their flight patterns, and it's just one more challenge that's been impacting the corneal transplant landscape. So we have significantly reduced our forecast for the total number of corneal transplants when compared to our pre-COVID-19 forecast. We expect the sharpest decline to be in India in regard to the total volume of transplants lost in 2020. The impact of COVID-19 has been incredibly challenging for the industry and presents uncertainty for the future. MarketScope has been closely tracking the effects of COVID-19 since the onset and will continue to track the impact and adjust our forecast and assumptions as needed. Our new 2020 Global Cornea Products Market Report will be published in November. For more information, visit www.market-scope.com.